A woman in her 40s is at a fitness class. She pauses before a jump, glancing toward the restroom, looking nervous. Hi, I'm Dr. Behnaz, a certified pelvic floor specialist. And if you ever leaked a little urine when you sneeze and also had to rush to the bathroom with a sudden, strong urge, you may have what's called mixed urinary incontinence. It's common, it's complex, and most importantly, it's treatable. Today, I explain what mixed incontinence is, how stress and urge symptoms affect each other, and how pelvic floor therapy can treat both step by step. Mixed incontinence means you have both stress and urge symptoms. That might mean leaking when you jump, laugh, or lift, and also feeling a sudden urgent need to pee, or experiencing both on the same day or even at the same moment. It's especially common for women in perimenopause and after menopause. What causes mixed incontinence? There is usually more than one cause. It could be pelvic floor muscles that are slow or react or underactive, stretch tissues or ligaments after childbirth, weaker urethral closure or thinner tissues from low hormones after menopause, or overactive bladder muscle, a sensitive nervous system, bladder habits like going too often or not fully relaxing when peeing. Sometimes the pelvic floor is weak and tight at the same time, tired from underuse but also holding tension. This combination creates leakage caused by both muscle changes and nerve activity. So when someone has both stress and urge symptoms, we take a careful step-by-step approach. We ask what situation caused leaks, which is more bothersome, urgency or stress leaks. How often do you go to the bathroom? We also review hormone status, birth history, the surgeries, and medications. We check pelvic floor strength, endurance, timing, and coordination, any tightness or scar tissue, how your bladder reacts to triggers like running water, cold, or unlocking your door, how you manage pressure, such as whether you hold your breath when you move. We look at how the whole system works, not just whether it's tight or weak. Treatment is tailored to you. We start with the symptom that affects you the most, then address the other. If urgency is worse, we focus on bladder retraining and urge control first. If stress leaks are worse, we start with pelvic floor activation and strength training. For urine urgency, we use urge suppression techniques, scheduled bathroom times, bladder diaries to track progress. Trigger control like breathing and pelvic floor activation before unlocking the door. If the pelvic floor is too tense, we add diaphragmatic breathing, visualization like picturing a flower opening, gentle release exercises in the supported positions. Once urgency improves, we focus on stress leakage, building a strength with endurance holds and quick squeezes. Using the neck, a small pre-squeeze before coughing or lifting. Functional movements like sit to a stand, stairs, and squats with good coordination. We progress step by step, lying down, sitting, standing, moving, walking, lifting, jumping, all with proper breathing to avoid pushing down. By the end, patients are going to the bathroom every 3 to 4 hours, able to delay urges, leaking less during high demand activities, confident the pelvic floor will respond automatically. We'll confirm this with real life tests like coughing, jumping, and running. Okay, let me bring you a real life case. A 60-year-old woman came to me feeling frustrated. She leaked when coughing and had sudden urges. She had weak pelvic floor muscles, a tight vaginal canal, frequent just-in-case bathroom trips, avoided movement out of fear. In the first 4 weeks, we focused on relaxation and bladder retraining, and in the next 4 weeks, weeks, we worked on her functional strength and the neck technique. In the last 2 weeks, we trained her for light jogging and daily activities. By week 10, she was dry, confident, and back to gardening and exercising. Key takeaways for you. Mixed incontinence involves both stress and urge symptoms. We treat the most frequent or bothersome symptom first. Lasting results come from combining bladder strategies with pelvic floor rehab. Every plan is tailored to your symptom, your body, and your life stage. In the next video, we'll cover menopause and incontinence, how hormones affect bladder control, and what you can do about it. If you've been told this is just aging, remember, aging doesn't mean you have to live with it. You're not alone, and you're not stuck. I'm Dr. Behnaz, a certified pelvic floor specialist, and if this video has been helpful for you, I'd love for you to join our community. Subscribe to the channel, like the video, and turn on the notification bell so you'll be the first to know when new pelvic health tips are posted.